Hey there, this is Daniel with New Life Med, here to help you out with your new NMES or muscle stimulator. So this is your typical muscle stimulator. It does come with a 9-volt battery on the back side that you'll just put on in there. Alright, and then cover the back up. Now, the device itself, you slide this front carriage down and it does have some set buttons and those types of things. Your New Life Med rep will actually be the one to set it for you and then instructs you on how to change those settings if need be. Okay? So the NMES machine, or the muscle stimulator, is designed to strictly re-educate your muscles following a major surgery or injury. So they do that by causing a contraction to the muscles, and specific ones which we're going to show you for somebody who have just had an ACL type surgery or a major knee surgery. So you'll see your unit here has 2 ports at the top for the 2 leads here. Okay, they will plug directly into that, and then the other end of the lead has 2 smaller leads, a positive and negative, that are going to go onto these 2 electrodes or pads. They just slide right in there. All right. And then what we're going to do initially for our knee is there's a couple target points here that we want to talk about. So we're looking at my quad, and you'll see here the main portion of the quad, and then you'll also see a smaller muscle that comes down in this direction. Okay? This muscle here, okay, is one that is very important in helping control your kneecap. So we are going to work on establishing a contraction for this muscle. You can see when I contract, that muscle is there, and then also a contraction for the larger portion of the quad. So our first channel that we plugged in, we're going to go ahead and isolate our smaller muscle here. So it does not matter whether it's positive or negative where you put these pads as it relates to this muscle. So we're going to stick one, you'll see I'm going to contract, you'll see where the muscle kind of ends right there. We're going to stick a pad right on that ending point, and then we're going to come up a little bit higher to where the muscle comes in this way. So you're going to stick that same pad there. So now we're isolating this smaller muscle to the inside of the thigh and just above the kneecap. Then we're going to have our other terminal here, our other lead, with our, again, positive and negative electrodes on the end of it. And what we're going to do here is we're going to isolate the larger portion of the thigh, or the quad. So we're going to put this pad in close proximity to the other one. You do not want to cross any of the electric fields here. This is an electric contraction that's separate from this electric contraction. And then your other pad, you're going to reach and put it up as high on your thigh as you can get it and stick it down. Right. That's your initial setup. The pads always go on before the machine does. So back to our machine here, you'll see you lift the little cage up, and these are your intensity dials. So you will turn, first of all, we're going to start with this one here, and we're going to turn it up ever so slowly until we can feel the current, and eventually a contraction, which you will see right there. Okay, it needs to be turned up as much as you can tolerate. If you can crank it all the way up and tolerate that contraction, please do it. Okay? But you do want a visible contraction. This is to help aid in you not losing as much muscle tone. So you want that visible contraction. Now the machine will not maintain the contraction constantly. It will contract and hold for a certain amount of time that has been set by your rep, and then it will relax for a certain amount of time that has been decided by your rep based upon the physician's guidelines. Alright, once you have this one set, you're going to go ahead and work on the one that's a little bit higher, which will be a little more difficult to see on me, okay, but we'll go ahead and turn it up and get that one going, and there you go. So you'll see my leg contracting, and that's exactly what we want. And again, as high up as you can tolerate, and then it will move into a relax phase. So I have turned them up as much as I can tolerate. I'll close it. It does have a timer on it. Again, that will be preset based upon your physician's directions and what your rep determines to be appropriate for you. Okay? So once you have it all on, You just let it run its course of time. That is the muscle stimulator. Take care.